Induction of labor. I know exactly what you're thinking. What is an induction? The goal of an induction is to help you have a vaginal birth when you haven't gone into labor on your own. There are many reasons to have an induction. Sometimes there are medical reasons, like high blood pressure or diabetes. You may be scheduled if you're past your due date. It can also be your choice after 39 weeks or an elective induction. But before we chat about methods of induction, let's review the labor process. Let's start with anatomy. The baby and the placenta are in the uterus. The cervix is the opening of the uterus into the vagina. In order for you to get to the part of labor where you start pushing, your cervix needs to do two things: dilate, or open to 10 centimeters, which is what everyone remembers from the movies; efface, which means the cervix needs to go from being thick to completely thinned out, as you can see in this picture. The induction process helps your cervix fully dilate to 10 centimeters and completely thin out, so you can start pushing. You'll get checked in for your induction when you arrive at the hospital. Your provider will do an ultrasound to make sure the baby's head is still down. He or she will then check your cervix to see how dilated and thinned your cervix is. Based on your cervical exam, your provider will have a discussion about the next steps for your induction. Let's briefly touch on the 5 different ways we perform an induction. First up is cervidil, which looks a little bit like a shoestring. It's placed in your vagina under your cervix and releases medication locally in that area. It stays in place for up to 12 hours. Cytotec. These are pills that dissolve in your cheek or vagina. You may be given a dose of these pills every couple of hours. Another induction agent is the catheter, the balloon. This balloon is placed above your cervix and inflated. The pressure from the balloon mimics the baby's head pushing down on your cervix. Usually when the balloon comes out, you're anywhere from 3 to 5 centimeters dilated. Pitocin, or PIT for short. This is a synthetic form of a hormone your body naturally makes. It goes through an IV and increases the strength and frequency of your contractions. Amniotomy, or breaking your water, is another way to help your induction process along. A provider will make a hole in the water sac around your baby, which helps release more hormones. It also allows the head of the baby to put pressure on the cervix. You may use all or some of these methods. Some can't be used in certain conditions, but your provider will walk you through the options that are best suited for you. Some more information about the induction process. Remember to be patient. An induction can take from 1 to 4 days. Bring something to read or watch. In the early parts of the induction, it's important to get as much rest and sleep as possible. This helps save your energy for the pushing phase. A cesarean delivery can happen for many reasons, whether you're being induced or go into labor on your own. Your provider will discuss with you when they feel a cesarean may need to be a consideration. Feel free to ask questions to your providers. They're there to walk you through the process. But keep in mind, our most important goal is to have a healthy mom and a healthy baby.